So hello, everyone. Welcome to the first SACRU webinar. My name is Isabel Capello-Gil. I'm the rector of the Catholic University of Portugal and the president of the International Federation of Catholic Universities. And I'm very pleased and proud to be hosting this webinar together with Dr. Takehito Kamata from Sophia University in Tokyo. And before we start, let me just say very, very briefly a few words about SACRU, the Strategic Alliance of Catholic Research Universities, which was founded in 2017. It is a venture amongst top global Catholic research universities. So it brings together Boston College, the Università Sacro Cuore in Milan, the University Ramon Llull in Barcelona, Universidade Católica Portuguesa in Portugal, PUC Rio de Janeiro, PUC Chile, the Australian Catholic University, and Sophia University. And we are committed to advancing joint research agendas and collaborating so that we together can increase global participation in research amongst Catholic research institutions, increase collaboration amongst researchers and our teams, and work together for the common good. So without further ado, I pass on to Dr. Kamata. You have to unmute yourself, Takehito. Yeah.
Hello, my name is Takehito Kamada, and I'm a project postdoc fellow at Sophia University. We want to welcome everybody for today's special SACRU webinar. We want to start off some logistics about the Q&A first. About 20 minutes before the end of an hour, my co-host Isabel and I will ask our guest questions from the audience. Mm-hmm. So the members of the audience can submit the question before that time via the Q&A button at the bottom of the screen. When you ask a question, please identify yourself with your name, with your home institution, and question. And now we have the honor of introducing our panelist. Our first panelist is Alexis Kalelhis. Dr. Kalelhis is a professor at School of Biological Sciences and Medicine at the Pontificia Universidad Católica de Chile. And then also the second panelist is Xavier Simons. Dr. Simons is a postdoc researcher at Plunkett Center for Ethics at Australian Catholic University and the 2020 Fulbright Future postdoc scholar. And at last, the final panelist is Dr. Nadia Abrazam. Dr. Abrazam is an assistant professor at Cornell School of Nursing at Boston College. Now, on to the discussion, and great to have everybody here at today's SACRU panel. I want to address the first question to our panelists. Now, first question is Dr. Kalelhis. In terms of COVID vaccine, what challenges do you have to conduct clinical research in developing the COVID-19 vaccine in Chile? Please explain your experience and knowledge. Thank you.
You have to unmute yourself, Alexis. Yeah.
Yeah, I was trying to unmute, but I wasn't allowed. Now I was allowed, so thank you so much. So thank you, Dr. Kamata, Dr. Hill, for the invitation. I think it's very important, and congratulations for this webinar and for SACRU. I think it's very exciting that these kind of interactions are organized and eventually collaborations between different Catholic universities, different places of the world are important. I feel very, very fortunate to have collaboration with Catholic universities in the US, in other Latin American countries, as well as Europe. Thank you so much. And in terms of the question, Dr. Kamata, my experience here is that doing clinical trials is challenging, but I think it's also challenging to do them in other countries. I've been collaborating with colleagues in the United States and in Europe, and I mean, running clinical trials is a serious matter that requires a lot of expertise, a lot of not only technical, like scientific or clinical work, but also a lot of regulatory work in order to move ahead and get them done. For COVID-19, it's been impressive how the World Science has organized in a very collaborative manner, and we have now several front-runner vaccines that are under phase 3 evaluation, which usually takes several years, even decades, to get there. So I think that's very good news. I mean, it's a pretty good sign that associative scientific work leads to results sooner than individual work. It's a discussion that we've been having here in Chile, is whether we should support individual research or associative research. I think what we have seen in terms of COVID-19, not only in vaccines, but also in like diagnostics and other tools that are required for approaching this pandemic, we can appreciate how important it is to work in collaboration. So in Chile, we've been approaching this, I will say, from the standpoint of making our own vaccine. And we have a couple of groups, including my own, working on a vaccine that is made here, and we have made important progress in terms of preclinical results, but also based on this successful experience we had in terms of making vaccines here. We have established collaborations abroad in several countries. Most of them are formal collaboration by the means of agreements and grants, and we were able, unfortunately, to take advantage of those collaborations to be part of a collaborative effort to develop clinically some of these vaccines. And as well as we are working on a vaccine of our own, you know, this will be research and development made here in Chile. We will also be part of clinical trials for vaccines that are being pursued by other groups. Some of them, people and groups that we knew before the pandemic, based on collaboration, scientific collaboration that we have established. So just to briefly comment on your question, it's very challenging in terms of funding. That's, I think, is one of the major problems we have. In terms of human resources, we have a pretty strong scientific community and a very strong clinical community willing to be part of clinical studies. So I think we are strong on that. Also, we have a very strong university network. We put together a consortium of universities. Formally, we signed an agreement to actually take the maximum advantage to the infrastructure, the teams we have, the equipment we have for approaching COVID-19. And so it's a consortium that we entitled Consortium for Evaluating Vaccines for COVID-19. The Catholic University is leading that consortium, and there are other 10 universities that are formally part of that. And so we are doing all the trials as a collaboration between this network of different universities. I think that's something good. I mean, we have this willingness to collaborate and associate in order to approach this very major health problem that is affecting not only the health of people, but also the economy, education. There are many things that are being, affected by this terrible disease that we are suffering at the moment.
Thank you very much. Now, I have a question to Xavier Simmons. We've all heard recent announcements in the US, I'm speaking prior to the US election, claiming that the vaccine would cost up to $2,000 per patient. In Europe, we know that governments are securing millions of doses to be able to cover their respective populations who will have access through the national health services. But clearly there is an unevenness in global public policies regarding the access to the vaccine. How do you see this? How may these unevenness be curbed in a way so that no one is actually left behind? Do you believe in global policies or recommendations such as by the World Health Organization to guarantee access to the vaccine? What is your view on this problem?
Thanks very much, Isabel. And I'd just like to say, yes, it's a pleasure to be part of this SACRU event and to be on a panel with Alexis and Nadia. So, yeah, thanks again for the question, because I think this is a question that gets to the heart of how we are going to globally get out of this crisis. So, in theory, vaccines represent a bit of a beacon on a hill for countries seeking a definitive exit strategy from the COVID crisis. And yet we do have this problem of inequality of access, both nationally and globally. So I can approach the question maybe from those two aspects, looking at a national and a global perspective. So I think nationally, my personal view is that vaccines should be free at the point of delivery, because I think this is a crisis of sufficient gravity such that it demands every kind of if you will, effort is made by governments to ensure that the population is protected from it. It's in everyone's interest to get us out of this crisis, so to speak. So I think that in Australia, to focus on my own kind of context, I mean, I work for the Australian Catholic University and I'm based in Sydney. In Australia, the federal government here has pledged to make the vaccine free for all of those who wish to receive it. So I gather in the US that vaccine doses themselves will be government funded, though vaccine providers will be able to charge an administration fee for giving the shot to someone. So I think it's important that people aren't discouraged from getting vaccinated because of the cost. Like, I personally believe that there are already enough sources of vaccine hesitancy surrounding COVID vaccines such that we don't want to create a further source of discouragement for people to be vaccinated. So I think that's a very important policy consideration for governments and health authorities to bear in mind. Globally, I think it's very important that we have a plan to vaccinate as many people as possible in as many countries as possible. And I think that it's heartening to see that there are many international organizations working on this issue or working towards this goal of sort of a global vaccine program. So for example, the WHO, the Coalition for Epidemic Preparedness, Innovation, and Gavi, the Vaccine Alliance. So those sort of organizations have joined together to set up a global collaboration called COVAX, which many of you would have heard of. So this is designed to speed up the development and manufacturing and equitable distribution of vaccines. So countries that sign on to this collaboration get access to a broad portfolio of drugs, new vaccine candidates for COVID. But importantly, COVAX ensures that all countries, regardless of their income levels, their ability to pay for coronavirus vaccines, will have equal access to the vaccine candidates once they become available. So to round off my answer, I mean, I'd just like to point participants in the way of the WHO's recently published values framework for the allocation and prioritization of COVID vaccines. So one of the points that the framework makes, in fact, its overarching goal is this idea that COVID vaccines need to be distributed equitably around the globe, and it sort of, the document has as a central principle the idea of global equity. So I do think this is something we need to think seriously about, particularly in light of the fact that this is a pandemic, a global public health crisis.
Thank you. So my question will be Dr. Eversam. So we know that you're epidemiologist. So you have expertise in mathematical modeling, data analytic approaches in public health. So my question will be, in terms of COVID-19 vaccine access, what inequities and challenges do the communities of vulnerable populations confront in the United States?
Thank you. This is a fantastic opportunity. I'm so pleased to be here and very grateful for the invitation. Thank you for all of the efforts put together to put this together. So I think this is a very important question. This is a question that in the United States we're thinking about very carefully. Just because we have a vaccine and a vaccine is effective and efficacious doesn't necessarily mean that, as was just stated, people will take it. People need to have access to it. And need to also trust the system from which the vaccine comes. So I think it's really important to note that a vaccine is just one part of our public health response to this COVID crisis. And while it will be a very important part, it cannot stand alone. And so I think it's also important to note that there are communities, I'll speak for the United States in particular, that have just honestly been really disrespected and have not felt safe because of past public health and medical efforts here in the United States. And so we really need to be very cognizant of the ways in which these communities will react to a vaccine. We need to make sure that we're working with these communities to understand what it is that they need, how it is that they need it, and how it is we can best approach them with regards to this vaccine. And again, I think the important part is to remind people that the vaccine is part of a larger public health strategy. And that really requires us to strengthen our public health framework. And I say that specifically with regard to the United States, because as we know, prior to the COVID pandemic, public health in the United States was very severely underfunded. And in fact was undermined as a system. And so we really need to think about how it is we're going to build the system back up to allow for an effective vaccination strategy, especially among communities that are vulnerable.
Thank you, Nadia. Now, more of a provocative question to Alexis. The vaccine development run is being perceived as well as a global strategic combat amongst domain players in markets between countries. And even 2 days ago, we had a public health official, someone from the government, saying that the Pfizer announcement about the efficiency of the vaccine was a global publicity stunt. So as a scientist, how do you assess the efficiency of the vaccines and especially the effort that you are very much a part of in Chile? Will there be resilient immunity? How assured can we be that vaccination is truly going to solve the problem of this terrible disease?
Well, thank you, Isabel. I think there are a couple of questions in your question. In terms of whether a vaccine is efficacious, it requires completion of clinical studies. That does not prevent the scientist to sort of foresee or come out with preliminary conclusions based on the data and that are being generated. So if during a study for efficacy evaluation, if there are enough cases of COVID-19 in this case, then you can tell, and that is done by an external committee that is called Data Safety Monitoring Committee. That committee can look at the data and based on that data define how the efficacy is looking at. But it's not conclusive, it's a preliminary report of the study. So I think that's my first comment is just we really need to complete the studies and then wait until they are finalized, revised by the external committees, and eventually revised by peers in a scientific publication. Now, so not because I'm a scientist, it means that I'm not an optimistic person. I think it's good to be optimistic. I think it is amazing the way science has worked on this pandemic in terms of working on vaccines and other solutions. But I 100% agree with what Nadia said about that the vaccine by itself is not the end result. There is a lot of discussion especially in the social media about vaccines, and it's amazing the kind of stuff that you can read there. And I try to read them once in a while because it's important to know what's going on. So it's a lot of there is a. I think we should spend not. I think we should spend time as scientists uh, um, communicating the importance of vaccines, the discussion about the pricing that Xavier was referring to. I think is very important. This is an unusual situation. It's a pandemic. Everybody's suffering because of this. I think money shouldn't be an issue. It shouldn't be the vaccine only allowed shouldn't be people with better means, economical means have an advantage compared to people with lower means. So I think there's a lot of things that go around the vaccine that might be even more important than the vaccine itself, because you require this access and communities to appreciate the importance of using the vaccine. And just to give you an example, something we did here, and I had the chance to show it in some conference I was invited to give in the US and other places, is we put together here a museum for that is called Museum for Immunology and Vaccination, and it's based on the notion that vaccine hesitancy is built on this sort of wrong notion of safety in terms of diseases that apparently are not there, like measles. Measles is the best example. Was defined as eliminated from the U.S. in 2000 after about 15 years of using the vaccine. But that message of elimination that was well meant led to people to assume that disease was not really a threat, was not a risk. So why should I give my child vaccination if there's no reason? So we think that the hesitancy for vaccine use doesn't have to really do with adverse effects or with this pharmaceutical companies conspiracy, but has to do with this notion of risk. So in order to approach that, we put together this museum that is open to the public, that where we show the basis for these diseases, like for example, polio, measles, etc. We explain that even if they don't seem to be there, they are there, they are in the environment, and that making a vaccine, takes time, that vaccines are evaluated, and we have to be totally transparent and totally honest in saying that as any kind of medication, vaccines might have side effects, but the benefit is way more important than the side effects. And just to finalize, Isabel, something that I think is important also to keep in mind, it was a very nice article in I think it was in Nature a few months ago, indicating that in order to gain the trust of the of societies into the vaccine, science and clinical trials need to be really transparent. So I think people are demanding not only good science, not only rocket science, as we say, but also transparent science, that we can tell what we do and we are clear, and the message is simple and the wording is simple. So that transparency is required in order to have more people accepting the use of a vaccine. Although I think most of them want to use it, I think it's important to reach to those that don't want. A way to reach to them is to be very transparent and very clear on what the science is doing in terms of trying to prove that a vaccine is safe and efficacious.
Well, thank you. So my next question will be for Dr. Simons. I know we are very glad to know under especially this COVID-19 influence, your doctoral work focused on, part of your doctoral work focused on resource allocation in healthcare. So my question will be, in terms of COVID-19, especially vaccine distribution program, which level of government, is at the federal level, state level, or local level, will be key to implement the distribution program in Australia?
So I think this is also a very important question. I'd start by prefacing my answer by saying that obviously, like, government coordination between different levels of government in any jurisdiction is crucial to ensuring an effective vaccination program happens. So I think that what you've seen in different countries over the course of the COVID pandemic are more or less effective responses, and often the effectiveness of the response does actually relate to this aspect of coordination between the different levels of government. One good thing that's happened in Australia during the COVID pandemic, and it's quite a miracle, because I mean, like, political cooperation is pretty hard to find these days in any country. But we had in Australia a thing called the National Cabinet established, which is basically state and federal and territory leaders in the country working together as part of a cabinet to deal with the various challenges that the COVID-19 pandemic presents. And it was a remarkable period of political cooperation and goodwill that we had for at least the first 6 months of the pandemic. That's kind of broken down now, but I think at least there was a sort of a period there where we saw what we could get done if we worked together. So I think this sort of thing is very important with vaccine distribution, that'll be important in Australia, for example, that the National Cabinet works well with state and local government to ensure that basically the vaccine can go from being approved to being implemented to being rolled out in the community as quickly as possible. I think one challenge we face in Australia is that it is a very big country, obviously, and we have a lot of rural and remote communities. I mean, Indigenous Australians, for example, often live in very remote communities that are hard to get to, yet alone to provide healthcare to. And I think one of the big issues with vaccines, right, is that you need to freeze the vaccine, like in many cases, and those sort of storage facilities may not be available outside of major metropolitan centres. So I think that for this very reason, you're going to need a very coordinated response. I think that one of the reasons why the Australian government has invested in multiple vaccine candidates is precisely because they recognise that they're with such a diversity of healthcare contexts or settings in Australia, you're going to need multiple healthcare interventions or sort of vaccine interventions to provide that for the community. So at the moment, I would say that, like, yeah, the initial signs are good here in Australia. There's been some very hard lessons learned between state and federal governments in the way that they handle aged care, and basically the regulation of aged care, because there was a bit of in the end, it was a tragedy what happened in the Australian state of Victoria during the wave of coronavirus infections we had there in the past few months. But that largely had to do with a problem of lack of coordination. So I just close by saying once again that I think that this issue of coordination between the different levels of government is really the key to having an effective vaccination program.
Nadia, more of a macro question. One of the things we see growing is growing fear about the notion of infected people. Maybe we'll tame COVID-19, but something else will come after. As an epidemic, and this sips over from fears in the community, research, into social media, but also popular culture. I mean, we have a growing number of film series about contagion, virus spreading pandemics. How can we create resilience? Of course, there's a lot of uncertainty. How, or is it even possible to create a certain resilience in communities vis-a-vis a world where you may be liable to move from one epidemic to another, from one pandemic to another, right? As an epidemiologist, how do you see this?
Yeah, I think this is a great question. I mean, I think we have to come to terms with the fact that infectious diseases have always been used historically as a way to other people, right? Folks who are sick, folks who are more susceptible are seen as perhaps unclean, perhaps they are poor, they live in crowded areas. So infectious diseases have always been used as a way to segregate communities and really break down the sort of inclusivity of particular areas. And I think you're right. I think we're living in a world now where social media and different types of media have really made this a little bit more glamorized and even scarier. But we're also living in a world where we should expect a number of ongoing epidemics and pandemics. Because of climate change, because of the ways in which our society is functioning, the globalization in which we're living in, we do expect that these infectious diseases will be popping up more often. So I think your question is really important, because I think the key here is, and this relates back to the question that was asked earlier, the key is really to make sure that people understand the science behind what is happening. I think it's really important to empower communities to take on the education of infectious disease transmission, to take on the education of what does a vaccine do. And I think we also have to make sure that this is happening from the community level. It should be grassroots. It should not always be coming from above. I know there's a lot of power in having sort of governments helping, but I also think that we need to be able to empower communities to take this on and to understand what is best with regards to both communication, prevention, the ways in which communities function socially, what particular communities need in terms of social interaction. That's going to differ from place to place. And so this really needs to be, we really need to start engaging with these communities at the grassroots level and empowering them to take on this challenge as a community. And I think it could lead to resilience, especially those communities that are engaged with the science. I think the challenge here, and this also relates back to something that was said earlier, is the politicization of these infectious diseases and the ways in which this disease has actually become a political ploy in many parts of the United States and in many parts of the world. And I think that that is really what's going to discourage communities from engaging in these issues, because once it becomes a political issue, I think that that really starts to deter communities from taking it on as something that they need to tackle as an individual community or as a group. So I think we're dealing with a number of issues all at the same time, but I do feel like there's an opportunity to empower communities to take this on as a plight that they can try to tackle together. And I also think we need to start thinking more about linking causes, specifically causes related to climate change, and how it is that we can start linking these conversations together so that people understand that, you know, the reason we're seeing these the increase in the number of epidemics is very much related to changes in our world. And so I think there's many opportunities here. They may seem challenging, but I'm encouraged that there are many people who are interested in taking these challenges on.
Well, thank you. So my next question will be for Dr. Kalelhis. I know you're leading scientists and researchers, and you're also the director of the Millennium Nucleus at the Institute on Immunology and Immunotherapy. So from your professor perspective of microbiology and immunology, how do you train young scientists, especially emerging scientists, in your academic field under the influence of COVID-19?
Well, it's been, thank you for the question. I think it's very important. Our main mandate as an academic institution is to train young minds. So that's, I think, is the main our main work. And this year has been pretty hard because here in Chile, most universities have been sort of all of the training is off campus. So we have to be creative in terms of defining projects that could be done from their computers. So I usually in a normal year, the students that come to my lab, I'm very fortunate. I have about 30 people working with me. So I have this constant challenging, it's very motivating. So I usually, when anyone joins my group, then I let that person read the kind of work we do and also talk to other members of the lab. And I usually encourage them to find a question that they would like to answer. So I believe that that's the most important and critical step in my way of seeing training, that the person finds a question that he or she wants to tackle. So then after defining the question, then sort of the fun begins, because they really are motivated by that question, because it's a puzzle for them. And then we need to solve the puzzle. And then by this puzzle solving process, we need to find a methodological approach. We need to find sometimes collaborators. Sometimes those collaborators are not here, but they are in other places. So some of the students have the chance to visit labs of collaborators that we have in the US or in Europe or now in Asia. So there is an opportunity for them to go beyond the community that we have here. But that definition of the question that motivates them to actually do scientific work, I think is a very critical step. Now, in terms of the classrooms, I think that's, I really love teaching. I have the chance to teach a class that I lead, but also invited to teach in several other courses here. And I remember when I just became as a faculty here, I think a year I taught like 200 lectures. It was really a lot. But it was great because then I had the chance to tell the students not only the basic knowledge of the particular subject I was teaching, but also had the chance to tell them the sort of things that we can do here. And I was, you know, I could see that several students liked it, and they decided to, you know, work on it. And that's very, very motivating to see a student that goes into a classroom, you know, start learning about a particular subject, and now some of them are, you know, very successful faculty or scientists in other universities here in this university as well, in other countries. Some of them have positions abroad. I think that's the most sort of like, you know, gratifying result when you see how these young students learn and they become excellent at it, and eventually are able to pursue their own ideas, their own questions. So that because working with them, I encourage them to find a question that they like, because I think that sort of curiosity that is, I mean, curiosity is something that is very sort of like individual, very, each person has different, is curious about different things. That is not very easy to influence. I mean, you might be curious about something that somebody else is not. So that I try to explore that curiosity and try to promote that curiosity becomes a question, and then it'll help them to you know, tackle the question. And that's the way I approach it. And I think, just to be totally honest with you, Dr. Kamara, that's the thing that motivates me the more. It's just to have the chance to interact with young scientists that have dreams, they have They have this. They're very sometimes idealistic, and that is really motivating. And to me, it's a big encouragement to do what I do.
We have roughly 20 minutes, 19 minutes to go. So I think we should now move on to questions from the audience, and we have a number of them. So I will ask two and ask then our panelists to respond. There is one from Jacqueline Sly from BC about the risks of achieving herd immunity. And the risks of infecting or introducing infected individuals in an unchecked manner. So this seems very risky, Jacqueline says, whether you could elaborate on the risks. And the second question from Yvonne Moreira from the Catholic University of Portugal, again on risks, increased risk for people of getting a vaccine that with the shortened testing. And I think Alexis has already responded to this, but if you could briefly maybe, well, any of you would like to respond to these two, and then we'll go in batches of two for the next session.
I'm happy to start,
Okay.
if you don't mind, with the herd immunity question. Thanks, Jackie, for your question. I think, as you said in your question, it's important to remember that the concept of herd immunity was actually a concept regarding vaccination. This idea that if we can actually vaccinate enough people, we will have enough immunity in a population such that we would expect the virus would no longer be circulating. That term, that concept was never intended to be referred to infection. It was always intended to be referred to with regards to vaccination. So I think that that's a very important element of this conversation that I think often gets left out. I have no doubt that there may be parts of the world, especially particular cities or areas, where herd immunity may actually exist at this current moment. There have been enough infections that the virus is not likely to continue transmitting in those particular areas. I believe from an ethical perspective, that's not really the tactic that we as public health professionals would vouch for. I think our goals are always about prevention, and we never really want there to be unchecked, unmonitored transmission occurring. So I think a lot of the conversations that we're having about herd immunity really come back to an ethical question of, you know, as medical workers, as public health workers, do we really want to have folks getting infected, and specifically I'm using the word infected, for the sake of public good, for the sake of herd immunity? And I don't think that that's something that we would value. Again, the concept of herd immunity was we want people to get vaccinated for the sake of public good. And that is a positive action, not a negative action. So to me, this comes down often to ethical conversations. Again, I don't think it's impossible. I actually think there are many parts of the world right now that are seeing some elements of herd immunity already, but I don't see that as a good thing. I see that as a failure of the public health system in those areas.
Mm-hmm.
Could I just add a quick note on that? I mean, I think seeing as this is a meeting of SACRU, an Association of Catholic Universities, I think that the principle of double effect, like a principle that has a lot of currency in Catholic kind of moral theology, right, is relevant here. That I mean, in a sense, in public policy, it's okay. Like we can have debates about the effects of policy when policies may be aimed at a particular goal, but there may be unintended effects, and we can have debates about whether we're going to be willing to tolerate those effects. But when you actually intend a bad effect, right, which might in this case be infection, there's something problematic about that. So I think there's something wrong just from the perspective of the intention of the policy, which should raise red flags in the minds of the general public as well as health authorities. So that's something just to consider here.
So maybe I could complement a little bit, Isabel, in terms of the herd immunity. I totally agree with Nadia. That's a concept that usually is applied to vaccines. And the whole reason of actually having vaccines is just to sort of train the immune system of people so they don't get sick, or just they get sick mildly. They have a mild form of the disease. So I think it's important that we keep pushing from the science and medicine in order to hopefully have not only one, but hopefully several safe and efficacious vaccines. In terms of the second part of your question, Isabel, that or somebody's question about the how
risk of
expedite.
getting the vaccine with the shortened time of testing.
Right, so the expedite development of vaccines, that's been in the discussion, public opinion in the media, but also it's been a big discussion in the universities, academia, and we are learning. I mean, I just make two conclusions. First, when a problem like this, or this of the seeking of a solution for a problem like this is prioritized, things can actually be done in a faster manner. So for example, instead of waiting in line for having a revision by a regulatory agency, if the COVID-19 technologies or clinical trials are bumped up in terms of revision, of course that shortens times. So the collaboration from regulatory agencies in that sense has been really important. And second, I just wanted to point out again to how collaborative this process has been. Not only scientists and medical doctors, but also governments, industry. Some initiatives in countries have received significant amount of funding in order to move as fast as they can. In a normal situation, when any one company or university is working on a vaccine, for example, you need to continuously be raising funding. And here we have examples where some projects have received a pretty strong support, and many of them actually have received a very strong support either from the government, so public funding, or private funding. So I think that there are several reasons to achieve this fast development of technologies. I don't think this has been lightly approached, or that the revisions have been superficial. I think it's just quite the opposite, because everybody, every day, or every hour of the day is paying attention about this matter. So you don't want to do things lightly or without enough care, not for this vaccine, not for this disease, because everybody is paying attention on this. So quite the opposite. I think the clinical trials are under a very strong watch, not only by the official agencies, but also by the citizens of the world. So you really better be careful and very, very systematic in what you're doing, because but that doesn't mean that you need to take longer time, because that also is under the scrutiny of societies. People don't want you to linger around for too long in terms of getting a solution. So I think there are reasons that explain, Isabel, why we are all surprised. I mean, usually a vaccine got to phase 3 after a decade, 10 years, 20 years. So that we are not even a year after the initiation of the pandemic, and we have already several vaccines reaching the final evaluation, and some of them being used as part of emergency approval. So I think it's very encouraging, and gives you a message that if we really get into it, we can do things quite faster, and as scientists, as regulatory agencies, governments, industry.
Hey, let me introduce the next question. This will be for the address to all of the panelists. This question from Raimundo Bakurian, School of Medicine and Public Health at Ateneo de Manila University, the Republic of Philippines. Question is about what else can we do to enhance global cooperation to ensure equitable delivery and access to COVID vaccine? also to more effectively deal with future pandemics. And then another one is the World Health Organization a sufficient platform for collaborative work?
Well, it's a big question, but I can have a punt at sort of starting off with an answer. So I think, I mean, one relevant consideration here is, I mean, we can sometimes jump straight from the national level to the global level, but I think thinking about regions might be also an important consideration here. So, for example, just to use this sort of Australasian or Oceanic context, Australia as the largest economy in the Oceania region has a certain responsibility, I think, an ethical responsibility to emerging developing countries in the region, and it's good to see that. I think what Australia has done when it signed on to COVAX is that it actually pledged funding for Pacific nations to receive access to vaccines. So it wasn't just a sort of generic commitment. There was a sort of a specific reference to Pacific nations, and part of that is self-interested, and part of that is kind of like ethical and benevolent. So the sort of the ethical and benevolent senses, I think there is a sort of a good spirit of cooperation between Pacific nations, and there is a sense in which Australia has historically been a leader in the region and has provided economic assistance to other countries in the region. But there is even just a self-interested argument that you can make, and I think this is something that policymakers need to take very seriously. And if that's the only thing that's going to move them, then they should at least take it seriously. Is that you're like, as a sort of a region, the way you're going to deal with the COVID crisis is by helping each other out. Because if one country still has like outbreaks on a regular basis, and there is some degree of travel or exchange of persons between different nations in the region, then that's going to basically cause problems for all the countries. So I think just sort of from a purely sort of from a political realist perspective, even I think there's a very good case for further global collaboration, ensuring equitable access to the vaccine. I don't mean to be a pragmatist, but I think that is something that needs to be considered.
And I just want to add, I don't think it's new. I don't think this is a new thing. I mean, we did this with HIV and AIDS, right? I mean, countries got together, they put their money together, they made sure that folks in other countries had enough money for treatment. I don't think this is a new thing. And I think we really need to remember our successes in the past of working together to try to fight some of the existing infectious diseases. So I think that we need to go back to the policies and the collaborations that have worked before.
Okay, so we're getting close to the end. So 3 questions quickly to our panelists. One from Russ Powell, who directs the question to Nadia on the issue of trust. When you're referring the lack of trust of communities, how do you think that trust can be restored to help ensure that anyone will feel comfortable getting a vaccine? Second one from Naveed Chowdhury, also from BC, to Alexis, about the mutations. How do mutations come into play when attempting to find a vaccine? And a third question from Magdalena Correa Duc, a nurse practitioner, student from BC, who asks, and I would direct this to Xavier, but all the others generally. My question is how we as citizens and healthcare professionals should evaluate announcements from regulatory institutions like the FDA, considering all the political influence that has surrounded the handling of the pandemic. So again, the issue of politics.
So I'll address the first question. I think trust is an interesting thing. I think we need to think about who's represented on our scientific panels, who's represented on our scientific teams. Do we have members of these communities on these teams? Do we have members who are contributing to the science? And then also, is the material that we're producing about vaccination accessible? Meaning, is it in the right language? Is it using the right vocabulary? Is it using pictures of people who look like these communities who have felt not represented or are distrustful? And then I also think we need to ask ourselves, are there other ways creatively that we can engage with these communities? Can we be using soap operas and movies to help encourage these communities to engage with the science, to engage with vaccination in creative ways? I think we need to think beyond. As scientists, I think we're really good at the scientific method, but I think we need to really think beyond the scientific method to make sure that these communities are able to engage with the work that we're doing in meaningful ways. And also, we need to gain their trust back, right? We need to make sure that all of the policies that we're implementing to prevent the spread of COVID-19 are respectful, are safe, are really just doing everything we can to regain the trust of these communities. And that's going to require a lot of effort, and it's going to require a concerted effort by a number of scientific bodies.
Thank you, Isabel, for the question. So I'll answer the question about the mutation immediately, but I wanted to say that about WHO, I think it plays a very important role, as well as other efforts like CEPI and Gavi. I think we need to encourage that more of those are there. But I'd like to also promote that. I think it's important to promote that peer revision is sort of increased in terms of the assignment of grant support, in terms of leading and providing finance for some initiatives. I think we do pretty well as a scientific community in terms of peer review, and we need to take advantage of that capacity. I think peer review committees that are actually, sort of international committees for reviewing applications are important. Now, in terms of the mutations, that's a main concern. I think still, in terms of the times that science needs to reach an answer to that question, I don't think it's enough time. We don't know yet whether there will be enough mutation or recombination on the virus in order to make it look different in terms of recognition by the immune system after vaccination. So we yet don't know whether this virus will require a seasonal vaccine, as the case, for example, for influenza, or whether the kind of changes that are accumulating, because we've seen some changes in the virus, would be enough for developing new vaccines, or whether a single vaccine would be sufficient. We still don't know the answer to the question, but that is something that the science is actually paying attention. And of course, if too many variations accumulate in the virus, new vaccines will be needed each time.
Great. So I can jump in and just answer that third question. I would say that it's important to consider both the responsibilities of regulatory authorities and responsibilities of members of the general public. So, I mean, from the perspective of regulatory authorities, I think they do have a duty to basically protect the integrity of science in the process of vaccine development. So there is, as we all know, a lot of political pressure in different countries for a vaccine to be produced quickly. It can kind of be a way of scoring political points in different contexts, and so there's this risk, right, that in the end the government bureaucracy becomes caught up in that whole process, or just bows to pressure from more senior levels of government. So I think it's important that doesn't happen. And I mean, you talked about the question mentioned the FDA. I mean, the FDA pushed back against the Trump administration just a month ago, or even less, when there was a proposal to rebrand emergency authorization as a form of pre-licensure, and the FDA said no, that would potentially compromise the integrity of our processes, and that was a very good thing, I think, and something that the public should realize, take as an example of the fact that organizations like the FDA are not compromising the scientific integrity or the kind of ethical integrity of their procedures and protocols in this whole vaccine development process. In terms of the general public, I think, I mean, sure, and health professionals, like, I mean, one needs to make one's own mind up about the science that's available, and are not discouraging critical thought and critical reflection on the transparency of the vaccine development process. But I do think that in terms of the public representations that particularly health professionals make, they need to be careful not to undermine the trust that the public has in organisations like the FDA, the TGA in Australia, and so on. Like, I think that's words have consequences, and we need to realise that there's a crisis of trust in scientific institutions in our societies. We see that played out in not just in the pandemic, over a whole course of sort of range of issues. And I think that because of that, health professionals have a particular responsibility to try to promote trust rather than undermine it, because we're already facing, as we mentioned at the start of this webinar, a bit of a problem of vaccine hesitancy in many countries. So I think the worst thing we could do is just like exacerbate that. Like I said, not to discourage critical thought, and where appropriate, kind of critical comments on transparency, for example. But I think that just to bear in mind the sort of the delicate balancing act that and the responsibility, social responsibilities of all members of the community.
Well, that's all we have for today's webinar. And Alexis, Xavier, Nadia, thank you so much. And also, we hope everyone enjoyed listening to the panel as much as we enjoyed hosting it. At last, we also want to thank you for being here, and thanks to the SACRU COVID-19 Working Group, which has organized the first ever SACRU webinar. Be well, stay safe, and seeing you soon next time in SACRU event.
Bye-bye.
Thank you. Bye-bye.
Bye.
Thank you.